In this lecture video, we will discuss about how the pharmacist should respond to symptoms in community pharmacy. Most of the patient, client or customers go to pharmacy in 3 reasons. First is requesting advice about symptoms. Second is asking to purchase a named medicine. And lastly, is requiring general health advice such as about dietary supplements. How will the pharmacist respond to a patient who is requesting for product? The person making the request might be an expert or a novice user. Expert user is defined as someone who has used the medicine before for the same or a similar condition and is familiar with it. Pharmacists and their staff need to ensure that the requested medicine is appropriate. The patient should be asked whether he has used the medicine before. There are outlines to follow in responding to a request for help with symptoms. First is information gathering. By developing rapport and by listening and questioning. Patient should obtain information about symptoms, to identify problems that require referral. What treatments have helped before? What medications are being taken regularly? What the patient's ideas, concerns and expectations about their problem and possible treatment. After gathering the important information, decision-making follows. In this part, the pharmacy could either recommend OTC medicine or referral for medical opinion required. The next thing to do is selection of the possible, appropriate and effective treatments as well as offering options to the patient and advising on use of treatment. To ensure a positive outcome, the pharmacist should tell the patient what action to take if the symptoms do not improve. Let's go now to the different symptoms commonly encountered in community pharmacy. Some of the respiratory conditions are common colds, cough, sore throat and allergic rhinitis. Let's first describe common colds, which comprises a mixture of viral upper respiratory tract infections. The symptoms of the common cold usually last for 7 to 14 days. The symptoms of common colds are runny nose, summer colds, sneezing, coughing, facial pains, headache, high temperature, sore throat and earache. Common colds can be confused with flu. Patients in at-risk groups might be considered for antiviral treatment. When will the pharmacist refer the patient with common cold to physician? When earache is not settling with analgesic. When there is facial pain, frontal headache. When the patient having cold is very young or very old. In those patient with heart or lung disease, such chronic bronchitis. When common cold is with persisting fever and productive cough. When common cold is with delirium. When common cold is with pleuritic chest pain. Lastly, if the patient has asthma. How to manage common colds. Symptomimetics are effective in reducing nasal congestion by constricting the dilated blood vessels in the nasal mucosa. One of the symptomimetics available in the market is phenylpropanolamine. Others like pseudoephedrine, ephedrine, oxymetazoline, xylometazoline are currently not available in the market. If nasal sprays, drops are to be recommended, the pharmacist should advise the patient not to use the product for longer than 7 days. Rebound congestion or rhinitis medicamentosa can occur with topically applied but not with oral symptomimetics. Symptomimetics should be used with cautions in patients taking MOIs, with diabetes, heart disease, hypertension or hyperthyroidism and other OTC medicine that can be used to manage common colds or antihistamines which can reduce runny nose and sneezing due to its anticholinergic action. Chlorpheniramine, chlorpheniramine and promethazine have more pronounced anticholinergic actions than the non-sedating antihistamines like loratadine, cetirizine and acrovestine. Diphenhydramine may also be included in cold remedies for their supposed antitussive action. First-generation antihistamines may cause drowsiness, thus, should never be recommended for anyone who is driving, or in whom an impaired level of consciousness may be dangerous, such as those operators of machinery at work. Alcohol and drugs such as benzodiazepines, phenothiazines or barbiturates may increase the drowsiness or CNS depression. Other drug treatments for colds include cough remedies, analgesics and products for sore throats that will be discussed later. For non-drug therapy, inhalants containing aromatic ingredients such as eucalyptus be used. Zinc, echinacea and high-dose vitamin C, over 1 gram per day, can reduce the duration of colds. Steam inhalation may also be used to manage common colds. Common colds or flu can be prevented by annual flu vaccination. Another respiratory problem or symptoms encountered in community pharmacy is cough. Coughing is a protective reflex action caused when the airway is being irritated or obstructed. Its purpose is to clear the airway so that breathing can continue normally. Most coughs are self-limiting and will be better within a few days with or without treatment. Cough of longer than 2 weeks duration that is not improving should be referred to the doctor. Diseases associated with coughing are bronchitis, pneumonia, tuberculosis, croup, pertussis, postnasal drip due to sinusitis, asthma, heart failure and gastroesophageal reflux. Smoking and drugs like ACE inhibitors can cause cough. Cough has two natures. It could be unproductive or productive. Unproductive cough is dry, tickly or tight with no sputum is produced. It is usually caused by viral infection and are self-limiting. However, productive cough is chesty or loose with sputum normally produced. Oversecretion of sputum caused by irritation of the airways due to infection, allergy, or when the cilia are not working properly leads to coughing. Sputum that is uninfected is known as mucoid. Colored sputum may sometimes indicate a bacterial chest infection and require referral. When will the pharmacist refer the patient with cough to physician? If the cough lasting for 2 weeks or more and not improving. If sputum is yellow, green, rusty or bloodstained. When there is chest pain, shortness of breath, wheezing, whooping cough or group of patient experience recurrent nocturnal cough. If there is suspected adverse drug reaction caused by medication or if medication failed to treat the cough. How to manage cough. The choice of treatment depends on the type of cough. Suppressants are used to treat unproductive coughs, while expectorants and mucolytics are used in the treatment of productive coughs. Demulcents that soothe the throat are useful in children and pregnant women as they contain no active ingredients. Dextromethorphan and butyrate citrate are cough suppressants available in the market. Codeine and phalcodine are currently not available in the market. Demulcents preparations such as glycerin, lemon and honey or simple linctus can be used in managing cough. Expectorants have two proposed mechanisms of action. They can act directly by stimulating bronchial mucus secretion, leading to increased liquefying of sputum, making it easier to cough up. Or they may act indirectly via irritation of the gastrointestinal tract, which has a subsequent action on the respiratory system resulting in increased mucus secretion. Example of expectorant is guaifenesin. Antihistamines such as diphenhydramine and promethazine and symptomimetics such as pseudoephedrine may also be used to manage cough. Theophylline can also be used for cough due to its bronchodilatory effect but requires prescription. Another OTC medications that can be used to treat productive cough is mucolytics. They act by increasing the expectoration of sputum through reducing its viscosity. Example of mucolytics are ambroxol, bromhexine and carbacystine. Another mucolytic drug is acetylcysteine that requires prescription. Some of the non-drug therapy that can be used to manage cough are steam inhalation and fluid intake. Steam inhalation may be added with few amounts of menthol and eucalyptus or any inhalant. 1 teaspoonful of inhalant should be added to a pint of hot water and the steam inhaled. Aside from that, increase fluid intake by 2 liters a day helps hydrate the lungs and hot drinks can have a soothing effect. Another respiratory problem or symptoms encountered in community pharmacy is sore throat. It is a pain, scratchiness or irritation of the throat that often worsen when you swallow. Most sore throats are self-limiting and will be better within 7 to 10 days. If sore throat persists longer, it should be referred to the doctor. Steroid inhalers such as beclomethasone or budesonide can cause hoarseness and candidial infections of the throat and mouth. Sore throat can be a sign of life-threatening infection caused by the suppression of white blood cells or referred to as a granulocytosis, which is a side effect of carbamazole. Smoking can also exacerbate sore throat. When will the pharmacist refer the patient with sore throat to physician? First, when sore throat lasted for 1 week or more. If there is recurrent bouts of infection such as tonsillitis. If sore throat is accompanied with hoarseness of voice for more than 3 weeks duration. When there is difficulty in swallowing or dysphagia. When the medication failed to treat the sore throat. When sore throat is extremely painful. If there is a presence of white spots, exudates or pus on the tonsils, and lastly when there is candidial or thrush infection. How to manage sore throat. Oral analgesics are first-line recommendation to reduce the pain from sore throat. Example of which are paracetamol, aspirin and ibuprofen. Lozenges and pastilles have a soothing effect that can reduce sore throat. Some of the drug available as lozenge and pastille in the market are dichlorobenzil and imometakrosol combination, cetylpyridinium having antiseptic property, diquilinium with antifungal action, and benzocaine with local anesthetic activity. Some of the mouthwash and sprays available for relieving sore throat, pain are bencidamine, hexatidine, and iodine-containing preparations. Another respiratory problem or symptoms encountered in community pharmacy is allergic rhinitis. Allergic rhinitis is associated with group of symptoms affecting the nose caused by allergens, which are harmless substances but trigger an allergic reaction. Allergic rhinitis has 2 types, the seasonal allergic rhinitis and perennial allergic rhinitis. Seasonal allergic rhinitis, often referred to as hay fever, and is typically caused by outdoor allergens such as pollen from trees, grasses and weeds. Perennial allergic rhinitis occurs year-round. It is usually triggered by allergens such as pets or dust mites. In terms of duration, allergic rhinitis can be classified as intermittent, persistent, mild and moderate. Intermittent allergic rhinitis occurs less than 4 days per week or for less than 4 weeks. Persistent allergic rhinitis occurs more than 4 days per week and for more than 4 weeks. In mild allergic rhinitis, daily activities of the patient is not affected and symptoms are not troublesome. In moderate allergic rhinitis, patient's daily activities may be impaired. Patient may experience abnormal sleep and troublesome symptoms. The symptoms of allergic rhinitis include rhinorrhea, nasal congestion, nasal itching, sneezing, itchy and watery eyes. When will the pharmacist refer the patient with allergic rhinitis to physician? When there is wheezing and shortness of breath. If patient experience tightness of chest. When there is painful ear or painful sinuses. If there is purulent conjunctivitis. And lastly, when medication is failed to treat the allergic rhinitis. How to manage allergic rhinitis. Antihistamines is the first-line treatment for mild to moderate and intermittent symptoms of allergic rhinitis. Non-sedating antihistamines available over the counter are acrovastine, cetirizine and loratadine, which are recommended for children over 12 years. Older antihistamines such as chlorpheniramine, clemastine, promethazine and diphenhydramine have a greater tendency to produce sedative effects. Another OTC drugs that can be used in managing allergic rhinitis are the decongestants like pseudoephedrine. Steroid nasal sprays can also be used as treatment of choice for moderate to severe nasal symptoms that are continuous. Beclomethasone, fluticasone and triamcinolone nasal spray can be used for the treatment of seasonal allergic rhinitis and in patients over 18 yoctoseconds old for up to 3 months. However, steroid nasal sprays are not recommended for pregnant women or for anyone with glaucoma. The last drug that can be used is sodium chromoglykate, or also known as cromolyn sodium, that can be effective as a prophylaxis at least 1 week before the hay fever season. Topical antihistamines such as azostine and levetiracetam are taken beginning 2 to 3 weeks before the start of the hay fever season. Aside from respiratory conditions, another symptoms commonly encountered in the pharmacy are painful conditions such as headache and musculoskeletal problems like sprains, strains, muscle pain, bruising, head injury, bursitis, fibromyalgia, frozen shoulder, painful joints, back pain and whiplash injuries. Let's first discuss about headache. Headache is classified as tension, migraine and sinusitis. Any headache that does not respond to OTC analgesics within a day requires referral for the nature and site of pain. Tension headache is the most common form, in which pain is described as being around the base of the skull and the upper part of the neck. Migraine is unilateral, affecting one side of the head, especially over the forehead. Migraine can be classified as common or classic. Common migraine attacks lasted for 4 to 72 hours, while classic migraine lasted for 60 minutes. For the frequency and timing of headache symptoms, cluster headache, or also known as migrainous neuralgia, happen daily for 2 to 3 months, and each episode of pain lasts up to 3 hours. Chronic daily headache is defined as headache that is present more than 15 days a month, typically occurring over a 6-month period or longer, and it can be daily and unremitting. Other diseases associated with headache are temporal arteritis and hypertension. Tension or psychogenic headache and migraines may be precipitated by stress. Other causes of headache are trauma or injury, deteriorating eyesight, and contraceptive medications. When will the pharmacist refer the patient with headache to physician? When headache is associated with injury, trauma. If the headache is severe for more than 4 hours duration. If there is suspected adverse drug reaction with the medication used. For headache in children under 12 years of age. If there is severe occipital headache or pain across the back of the head. When headache is worse in the morning then improves. For headache associated drowsiness, unsteadiness, visual disturbances or vomiting, as well as neck stiffness. For frequent migraines that requires prophylactic treatment. When headache is frequent and persistent. How to manage headache. Oral analgesic comprises paracetamol, ibuprofen and mefenamic with 250 mg dose are over-the-counter drugs that can be recommended by the pharmacist for headache. Stimulants such as caffeine can be combined with analgesics in treating headache. Antihistamine like doxylamine, whose sedative and relaxing effects are responsible for its usefulness in treating tension headaches. As well as buclizine, also an antihistamine that is included in OTC analgesic for migraine because of its antiemetic action. Aside from drug treatment, other non-drug therapy that can be used is feverfew, which is a herb that has been used in the prophylaxis of migraine. Aside from headache, musculoskeletal problems are also common in community pharmacy. Example of which is the sprains, which is an overstretching of ligaments or joint capsule with tearing. It is commonly involved in the lateral ankle ligament. Another problem is strain, where muscle fibers are damaged by overstretching or tearing. It is common in muscles that work over 2 joints such as the hamstring. Muscle pain is also a stiff and painful muscle which occurs after patient carries out activities that are not normally undertaken. Bruising is a skin discoloration, is initially red or pink, becomes blue, green or yellow, caused by escape of blood from ruptured underlying blood vessels as a result of injury. Another problem is head injury, in which pain occurs as a result of head injury. Bursitis is also an inflammation of bursae which commonly occurs in knees and elbows. In addition is the fibromyalgia, where chronic widespread pain affects both sides of the body above and below the level of waist for at least 3 months. Frozen shoulder is also common in elderly where shoulder is stiff and painful. This pain worsens at night and may relate to exposure to cold or exertion. Other musculoskeletal problems are arthralgia, which refers to a painful joints due to arthritis with limitation of movement. Back pain, which is a pain below the rib cage in the middle part to side of back, or associated abnormality in passing urine which occur after strenuous work. And whiplash, referring to a damage to ligament, vertebrae, spinal cord or nerve roots in the neck region that is caused by sudden jerking back of the head and neck, typically associated with accidents. When will the pharmacist refer the patient with musculoskeletal problems to physician? If there is suspected fracture. When it is caused by possible adverse drug reaction such as falls common with alendronate and bruising caused by anticoagulants. When there is head injury. When the medication used failed to treat the musculoskeletal problem. In case of arthritis. If there is severe back pain or back pain with numbness radiating to leg. When back pain occur in the middle or upper back, especially in the older patient. How to manage musculoskeletal problem. Topical analgesics and anti-inflammatory may be recommended, such as ibuprofen, ketoprofen and paroxicam. Analgesics are better administered topically to reduce the risks of NSAID causing gastric disturbance or ulcer. Also, the act of massaging the formulation into the affected area will increase blood flow and stimulate the nerves, leading to reduction in the sensation of pain. Counterirritants and rubefacient may also be used since they cause vasodilation, inducing a feeling of warmth over the area. Massage during the application of counterirritants will relax muscle and disperse prostaglandin responsible for pain and inflammation. Some of the liniments available in the market are methyl salicylate, camphor, menthol and capsaicin. Aside from drug therapy, other non-drug treatment may be used, such as glucosamine, which is combined with chondroitin. Complementary practices such as acupuncture and chiropractic. Application of heat can be effective in reducing pain. Also, the use of support products such as soft collars in whiplash, back support in back pain, compression support in sprain and foam support in bursitis may also be used. First aid treatment may also alleviate sprains and strains. Always remember the mnemonic RICE during first aid. R for rest, in which immobilization is done on first 24 hours. I for ice, in which administer cold pack for 30 minutes and is repeated every 2 hours. C for compression, in which pressure is applied using bending over injured area for 24 hours. E for elevation, where injured area are raised to aid drainage of fluid and reduce swelling. Musculoskeletal problems could be prevented by having a good posture and regular exercise. The last symptoms commonly encountered in community pharmacy that will be discussed in this lecture video is insomnia. Insomnia is a sleep disorder in which patients have trouble falling or staying asleep. Sleep problems include difficulty in falling asleep or sleep latency insomnia, waking during the night, early morning waking, poor sleep quality, and snoring. Depression is an important cause of insomnia. Early morning waking is a classic symptom of depression. Anxiety can also cause insomnia, usually associated with difficulty in getting off to sleep because of an overactive mind. In terms of duration, insomnia or sleep disorders are classified as transient, occur only in days. Short-term, which occurs up to 3 weeks. And chronic insomnia occurs longer than 3 weeks. Chronic insomnia should be referred to the doctor. Other factors that contribute to insomnia are work with changing shifts, alcohol consumption, life changes, stressful life events, obesity or medications including decongestants, fluoxetine, MOIs, corticosteroids, appetite suppressants, phenytoin and theophylline. When will the pharmacist refer the patient with insomnia to physician? If there is suspected depression when insomnia is chronic or longer than 3 weeks duration. And lastly, for children under 16. How to manage insomnia. Antihistamines reduce sleep latency of the time taken to fall asleep and nocturnal waking. Old antihistamines may be used due to their sedating effects. Diphenhydramine, promethazine and benzodiazepines requires prescription. Aside from drugs, other non-drug therapy is aromatherapy, particularly lavender oil and chamomile, which are effective in aiding relaxation. The usage recommended for these oils are 1 to 2 drops sprinkled on pillow or 3 to 4 drops in warm bath. Melatonin can also be used, which is naturally produced by the body's pineal gland during darkness and is thought to regulate sleep. Another herbal remedy is St. John's wort containing hypericum, which is commonly used in the self-treatment of depression. Snoring can be prevented by nasal plasters. While insomnia can be prevented by having warm bath 1 to 2 hours before bedtime, which can help induce sleep. Another is application of heat to relax the muscles and increase brain temperature. Also, sleep hygiene such as regular bedtime and waking time. No meals just before bedtime. No naps during the daytime. No caffeine after lunchtime. Reduce extraneous noise or may use earplugs if necessary. Restrict alcohol intake to 1 to 2 units a day. And lastly, restrict nicotine intake immediately before bedtime.